Thanks for joining us on another one of our video presentations of vertigo, benign positional vertigo. This is just a crazy scenario today that is just affecting tons of people. Movement, feeling of movement, sensation of motion, sensation of falling, spinning, tumbling. Really what it comes down to, this benign positional movement, if you will, it's a sensory data input information. You have these things called, in essence, otoliths. They're little calcium carbonate crystals that have to stay there, and they kind of work in conjunction with the cilia within the ear. And I don't want to get into all the details and the exact mechanism, but there's these little otoliths, and they can become dislodged, damaged, trauma, sometimes just as we age. The viral attacks, there can be attacks, there can be head, you could fall. But the overall concept is, we've done teachings on tinnitus, that noise, on Meniere syndrome that has more of a dietary component, a food sensitivity component to it, blood sugars that are dropping, hypoglycemic or reactive hypoglycemia issues. This one's different. This one has a structural issue in your ear, and you have this exaggerated sense of motion, of spinning, of activity, of falling forward, and it really comes down to it that there's just impaired sensory data input, and sometimes it's caused by these little guys, these little crystals. Are there nutrients that can be helpful? Yeah, I think there are. Are there some PT, physical therapy types of things that you can do that can be helpful? Yes, I think there are, and there's different types of procedures that you can do, and I'll try to give you at least one of them to give you some overall thoughts, etc. I would still say, for anyone suffering from vertigo, that you should still be keenly aware of blood sugars that could drop. Don't let that happen. Don't skip meals. So if you suffer from benign, paroxysmal, meaning intermittent, coming and going, positional vertigo, you've got to also be aware of, in general, that your diet could play a role. Blood sugars that drop could play a role. They could be a trigger. But ultimately, we've got this whole crystal issue that you have to deal with. Age-related, number one. Typically 50, 55 years of age and older. Now, there's a lot of literature talking about whether it's centrally activated or peripheral. There's this conflict of signals. And again, that's for an ENT to talk to you about. You should be checked by an ear, nose, and throat specialist. But what we want to just do is let you know that there's often answers for vertigo, and there's some help if you've been battling this BPPV, or we'll just call it vertigo for today. Overall concept, this vestibular disorder. Does it just go away with medication? No. Can sometimes medication help? Sometimes some physicians will use high doses of steroids. Often they'll use maybe medications like meclizine or a form of antihistamine to try to help. Those are temporary at best. I don't feel they deal with many of the root causes, this whole situation with these otoliths. There's a little bit of a scenario here talking about canalith repositioning procedures that can often be helpful for folks. So this dizziness, this lightheadedness, this sense of motion, this sense of tumbling, this sense of imbalance, is there a medication that cures? I don't think so. Many folks have used them, as I've already mentioned. I don't think that's the answer. How about let's just talking about some of these repositioning procedures that actually, in essence, start to reposition these little calcium carbonate crystals in the ear that can be helpful. So for a quick and the skinny, sit on the edge of the bed, put a pillow behind you that would basically, when you are going to lie down, would fall maybe at your mid-back or your shoulder, upper shoulder region. So you sit on the edge of the bed, and you should think about, you can do this, work with a physical therapist, a chiropractor can help you with this. Be seated, turn your head 45-degree angle, not 90 degrees all the way, but about a 45-degree angle. You should then gently and slowly lie back so that the pillow is up in your mid-back and your head lies back, but it's at this 45-degree angle and your head is back. You should stay there for about 30 seconds. When you're in this lying down prone position, you should then turn 45 degrees in this direction for another 30 seconds. And you can repeat that. Sit back up, repeat the procedure. Now, a lot of folks will tell you, physical therapists will tell you that you shouldn't lie down then for like a 24-hour period, which is pretty tough to do. Because what you're trying to do is reposition these crystals. That's what you're trying to do. You're trying to reposition these crystals. So let's just say try not to lie down for an extended period of time. I think that would be reasonable. And this procedure can be repeated. All right. So these little free floating crystals, we want to kind of have them reattach to the cilia so that these free floating bodies aren't out doing their thing aberrantly and sending the wrong signals and giving sensory data misperception and craziness that makes you feel kind of crazy as well. Okay, so if we've talked about the positioning procedure, about the otoliths, about this canalith repositioning procedure. So again, pillow on the bed. You're sitting up on the edge of the bed. Turn your head 90 degrees. You lie back. Your head is not on the pillow. Pillow's at the mid-back. The head is back, but it's at a 45-degree angle. 30 seconds, you roll over, 45-degree angle in this direction. This is attempting to reposition. Sit back up. Repeat the procedure. You can do this multiple times if you have to, and you can do it on consecutive days, but try not to lie down after you do this procedure, at least initially. All right. There's a Brandt Daroff exercise as well, sitting on the edge of the bed. You lean, you sit up to the side that you've had more issues, ear, and to where you have more vertigo issues. You do 20 repetitions, repeat either side a couple times a day. I kind of like this CRP, this canalith repositioning procedure. I think that has more data that can help you. Are there some other things that you can do as well with vertigo, though? Well, I mentioned it. Number one, be careful of your diet. Be careful of letting your blood sugars drop. Don't miss and skip meals. I think that's a huge issue. Ginkgo extracts. Can we use some ginkgo? We sure can. We use a standardized German source, a Ginkgo GBE. And we could do maybe 120 milligrams twice a day, 80 milligrams 3 times a day. We like using ginkgo. What that does, it enhances blood flow, because remember, this is usually an age-related issue where there's even some blood flow characteristics that are being impaired. Number two, there's some literature on vinpocetine. Vinpocetine at a high dose, 20 milligrams to 40 milligrams a day, being helpful for folks with vertigo. Number three, CoQ. I use quality forms of coenzyme Q10, 200 milligrams a day, sometimes go up to 200 milligrams twice a day with vertigo. I still believe that repositioning procedure, the CRP procedure, is the core of this, but there are some nutrients certainly that can help you. Niacin. If you have a history of atherosclerosis, arteriosclerosis, I would use some niacin. We use a form of niacin that is time-released, a time-released 500 milligram dose of niacin. I would start with 1 daily, and I would increase that to 2 daily after a few weeks, and I would divide the dose, 1 morning, 1 evening, okay? Niacin, time release. Increasing blood flow characteristics, vinpocetine with protection to the brain, the cerebrum, inner ear issues, ginkgo enhancing blood flow, powerful antioxidant. The last area would be, we use some straight quality lipoflavonoid products. Lipoflavonoids, niacin, ginkgo, CoQ. I think if you do this regimen, if you suffer from significant issues with benign paroxysmal positional vertigo, BPPV, I think you can do some nutrients that can be helpful. and you can do some procedures that can be helpful. Both of them, I think, can help you in this area long term. Sleeping. Some folks find that if they use 2 pillows, so that if your body sits as opposed to being completely prone, you sit in a little higher position with your chest, your shoulders, your head. 2 pillows seems to be helpful. Many folks find not lying on their side is very helpful. So trying to sleep face up is often very, very helpful. When you rise from a sitting position or from sleeping or lying down, that you should try not to move in haste, that you should move slowly so you don't jar and move those otoliths, right, the calcium carbonate crystals. Let your body and give it a chance to adjust and sensory data link more efficiently. The other area is the blood sugar issues that I mentioned, and in some cases, I mean, there is some literature that shows, and even though, as I said earlier, that I don't believe this is the core of this, but there's some literature that shows that food allergies and food sensitivities can play. And I would recommend doing a delayed food sensitivity testing to define it. Nutrients, how you sleep, how you lie down, doing the repositioning procedures, I think is a winning combination. Don't let your blood sugars drop. Don't skip meals. Maybe we evaluate for delayed food type sensitivities. All can be helpful. If you need some help, you can send us an email on our website, askjoed.com, or call us on an off-air toll-free number at 888-865-9595. I think this can help you. There's a lot of folks suffering and battling and have never really done these procedures, these CRP procedures, have never really utilized some nutrients, have just tried to use medications to manage. It's very debilitating. When it happens, it is incredibly debilitating. The sensation, the aftermath of feeling a sense of nausea and vomiting, and you just don't feel well. Everything's moving. Apply some of these procedures. I believe they can help you. Thanks for joining us for another one of our video presentations. I hope you're blessed by it. If you don't have this condition or you don't suffer from BPPV or vertigo, maybe you have a family member that has, and maybe it's an area that you can help them with by just directing them back to the website, askjoed.com or Ask Joe DiMatteo YouTube. God bless you. Thanks for being with us. See you on the next teaching video. See you then.